I think we might have a few others join, but it's past the hour mark, so we should get started. This is the Finance Committee meeting. It's a public hearing, as is all of our meetings. I'm Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services, and also serve as the Treasurer. We'll do introductions and we can dive into the agenda, which is posted on our website. Brendan, do you have something off the top?
Yes, before we start with introductions, I just want to introduce our new Ella, who is Katrina Bonish. Did I just pronounce your name right or wrong? We can't hear you. There's a problem with your computer microphone, but Katrina has filled in with the role that Ella had been filling, and before I didn't want her to feel left out of the introduction, so I just wanted to take a second to introduce her. Thank you.
Fantastic. So as we sort out a few sound issues with folks here, we'll proceed with introductions. I'll throw it over to Pat.
Hi, my name is Pat Kimball. I'm a recovery ally and the chair of the Recovery Council, and welcome aboard, Katrina.
Sheriff Brackett. That was a bad person to go to. Sheriff Brackett's sound is not working right now, and we'll continue to try to work on that, but he is on video here. Over to Miles.
I think my sound works, correct? Awesome. My name is Miles Willett. I'm a clinical supervisor at an outpatient treatment facility in Aroostook County. Also someone with lived experience and affected by the opioid epidemic and pharmaceutical companies. I will pass it over to Lydia, who just joined.
Hi, sorry to be running a few minutes late. Are we just doing introductions? Okay.
Lydia.
Great. Lydia Crafts. I serve House District 46 and work as a clinical social worker.
Thank you, Representative. But let's go over to Mary.
Hello, I am Mary Coyne. I'm the coordinator for the Maine Recovery Council. I also want to give everyone a heads up in advance. I am in the process of moving, and there's someone here to do some construction, so I may be off audio or video just briefly.
Not a problem. Good luck with that. Let's go over to Brendan.
Brendan O'Neill with the Attorney General's office.
Haley.
Haley Taranko, also with the Attorney General's office.
And since Katrina kicked us off, do you want to see if your sound's working?
Oh, we can try. Hey, I'm Katrina Bonish. I'm also with the Attorney General's office.
Nice to have you with us. And that is our group for today. We have until 2:30 for the Finance Committee meeting. We have a full agenda. Like I said, it's posted on the website, but I'll do a quick budget funding update. And we'll go through our somewhat standard at this point implementation topics with contracts, the letter of interest and application process, and vendor support. And I'll look to Brendan and Mary, as well as myself, to fill in some details behind those agenda items. And then we also, I think, wanted to cover, I think we might need to still cover OAG covered expenses and Maine Recovery Council reimbursement for that, but we can handle that at the end. Also notices in newspapers. I'm not sure if that is still a leftover item. I just wanted to touch base around one of the December 2023 funding priorities and making sure that we're all on the same page with next steps there. Are there any other agenda items before we begin? We can obviously take up any issues as we go along as well. So just quickly for what transpired from a financial perspective over the last month, in the month of June. June activity was pretty sparse. There were some administrative costs like payroll and travel reimbursement for council meetings, and 2 interest payments that we received. But we started the month with 30.6 million and we ended the month with 30.8 million. That is all I have in terms of budget updates and finance updates for that. I know we were expecting a couple recovery. I don't have the July summary yet. I usually get that the last week of the month or so, which is this week, but I don't have it. I don't know if we did receive, Brendan, I don't know if you know if we received any settlement payments.
Settlement payment. I don't think we received, Haley, correct me if I'm wrong, I don't think we received any since the last one. I can't remember if we talked about a small payment we received from Johnson & Johnson. And other than that, we're expecting my belief is we're expecting a significant payment on the 31st. Is that right, Katrina? Yeah, on the 31st from the distributors. That's Wednesday.
I think all the payments we've gotten were last month. I don't think we've gotten any since the end of June.
That sounds right.
Questions about our financial position?
No, looking
I
good.
will also say, I know we had a short discussion last month on, Courtney brought up the question of whether or not we could keep our funding in a higher yielding account by, I think the most logical way of doing that would be locking it up longer term as opposed to just in a cash account, like in a certificate of deposit or some sort of investment fund that might yield higher returns. I did follow up with the controller's office on that. They did not think that was possible. By statute suggests that it should be kept in the account that it is currently in, but I'm going to follow up with the treasurer's office, not the controller's office, to see if they have any difference of opinion there. But it's either status quo or good news there, and we can make a decision in the future on that. With that, I also, the only other thing, sorry, I should have said this off the top. I do think it makes sense. It's always budget season in state budgets, but the state is formulating its 26-27 biennial budget. Pat, I don't know if you've had discussions around potential state line positions for the council. We would have to do that legislatively, all state line positions. So any state employee needs to be created legislatively. I do think it makes sense for the council to consider doing that, and we would need to create a budget initiative. I don't know if we want to discuss that any further here, but I just wanted to plant the seed for consideration going forward. We would use our own dollars in the Recovery Council to do something like that. But are there questions or comments around that at this point?
So can I ask a clarifying question? So you're talking about having a permanent employee versus what we do now, which is we contract Mary. So have that. Okay, so that is a larger discussion that sort of changes our structure a little as to whether to have permanent employees versus a contract. So I think I'll probably at some point bring that up to the full council, or at least the executive committee, to make a recommendation as to how they want to move forward. Because Mary's contract, although we couldn't do it, we'd have to do it in 26 for the budget year, correct? We can't do it within this year. You have to do it within.
That's also
26.
That's a reasonable assumption based on how I framed it, but there will almost certainly be a governor's budget for fiscal year 25.
Oh, okay.
Supplemental budget, not the biennial budget, but that'll be proposed likely in fiscal 25, and usually that gets considered prior to the biennial budget, but that'll run basically concurrently. So there is a potential to create a state line in fiscal 25. Would be at the very tail end of the fiscal year, because budgets have been passing late in the session recently. I wouldn't So 25 or 26.
Okay, because what I think I'll do is I'll bring this discussion to the executive committee because Mary, refresh my memory, but I believe your contract was a year contract, which is up in November or October.
It is up at the end of November. It's up a week after, I believe, your terms expire. Or your terms.
Okay. So what I'll do is I'm going to call an executive committee meeting within probably within a month. I'll add that part to the agenda, a discussion on what we'll do with that, because Mary's contract will be part of that discussion where that is in November. So thank you for bringing that up, and we can add that to our discussion. And then if they have a recommendation, we'll bring it to the full board, I think, for discussion. We may run it past this board just for numbers' sake.
Great.
Ben,
Other-
was that my question was that the only position you were referencing, or were there any other positions you were suggesting?
In general, I actually think it makes sense to probably create multiple positions to support the Recovery Council. And I don't think we went through a bunch of permutations when we considered the coordinator position that Mary's filling right now. We considered whether it should be an executive director type position or coordinator or administrator. There could be certain roles. There could be something that on the more, Mary's sort of doing everything right now. So we could try to bifurcate some of that work between multiple positions. I do think 2 or 3 positions make sense.
Yeah, I do too. I agree.
Just for context, headcount's always a somewhat controversial topic with the legislature. It's creating a, expanding state government. This would be somewhat easier, I think, because there would be no general fund ask. We would use settlement dollars to fund those positions. So it would be a self-contained funding for those positions, but lots more discussion to have. Courtney, if you're available, thanks for joining. If you're able to, do you want to introduce yourself?
Hi, everybody. I apologize for my tardiness. I've been just running about 10 minutes late all day long, it seems. I'm Courtney Gary Allen. I am the organizing director of the Maine Recovery Advocacy Project, or MRAP, and a person with lived experience. Ben, is there any way you could give me like a 30-second recap of where we went in the last 15 minutes?
Happy to. I was about to go there. We just got started. I gave a very short update because there wasn't much activity in June from a financial perspective. We started the month with $30.6 million in the bank, and we have 30.8 now. We made a couple administrative type payments during the month of June and received two installments of interest payments. And we anticipate later this week receiving additional settlement dollars in the bank. Or in our account being deposited. I followed up with the controller's office. They did not preliminarily think we could use to shift our funds into other investment vehicles to generate a higher interest rate, but I'm going to follow up the treasurer's office to confirm that. They thought they might have it would be good to just confirm that, but preliminarily it looked like statutorily we're required to keep the money in the account that it currently is. And then we just had a brief conversation as you were joining on. I raised the fact that we should contemplate creating permanent state employees to support the council, so we don't have to just have a year-by-year contract for support, but that would be, as you know, legislative request. All headcount in the state, all permanent positions are created legislatively. So Pat's going to bring that up with the executive committee and bring it back to the council for further discussion as well.
Perfect. Thank you for accommodating my tardiness.
Not a problem. Glad you could make it. Okay, anything else on those items before we move on to contracts? Okay, I will look to Brendan. Do you have any items for discussion related to Piscataquis Recovery Center contracts or contracts in general?
Yes, the Piscataquis Recovery Center contract, which is with Recovery Wellness Initiative, is fully signed by all the parties and has been turned over to my office's finance team to take the steps they need to take to have the payment made. They've communicated to me that they are planning on, for lack of a more technical way to say this, push the button on the 30th, tomorrow, so that payment can go out the door on the 31st. All our understanding right now is that all necessary paperwork is in and has been presented to whoever it needs to be presented to, and so I will say that we are hopeful that the payment can be made on the 31st, and we will continue to monitor that situation to see that happens. So it could be that the first council money goes out the door on Wednesday. We've also, by the way, been in communication with the folks who are running RWI, and I've emailed Gordon, who is in touch with Dr. Starbird about that as well, in terms of timing. Happy to answer any questions about that.
Great news.
Yep. Over the weekend, I've been working on the contracts for the syringe service providers. Had a meeting this morning with Mary and with Katrina about those contracts. We're starting with a template of the CDC's existing contracts with the certified SSPs. We also briefly touched on the contracts for the treatment categories with Alfond, with the Alfond Foundation and the Maine Youth Action Network, in terms of pulling together necessary documents and information about those, with the hope that I'll be starting on those simultaneously with the SSPs this week. In terms of the SSPs, if I can just take a minute to either describe my current understanding or to ask questions to try to prompt feedback. My understanding is I'm writing a contract that will pay $75,000 per site of a syringe service program, such that if an organization runs multiple sites, they will receive the contract will provide for $75,000 for each of the sites that they operate, and that the contract will provide for them to allocate that $75,000 to each of the sites, rather than giving them a chunk that aggregates that $75,000 and allowing them to allocate it to where they think the need is. Instead, we're actually targeting $75,000 per site for each of the programs. That's my current understanding. So I'm just saying it out loud, and I can see I'm prompting feedback already. Pat, I saw your hand first, and then
yeah, mine's just a clarifying question. We approved, I believe, 17 sites.
This
certified. It was some number that was 17. We're not going over that, are we?
Mary and I and Katrina talked about that this morning. Mary's recollection, and I shouldn't be speaking for Mary, was that the council identified an 18th SSP that was certified shortly after the council's vote in December. So I'm planning on writing contracts that cover 18 sites, which amounts to some 8 or 9 contracts.
Yeah, that's what my recollection was. There was 17 current ones when we agreed, but there was one in the pipeline, and we were including that. So I'm understanding that right. Thank you.
Yeah, and just to chime in, it was the Program and Grants Committee, I believe in May, that we discussed this. So we're using part of that 200,000 allocation to supplement the 18th site this year, and then we already have 18 sites budgeted for year 2. So we still will need to decide that 125,000, how we'll go about that process with the startup funding.
Courtney?
Thanks, Ben. Thanks, Brendan and Mary and team. I just wanted to make sure we clarified that the word certified is a really important part of this conversation. So I believe there are some uncertified operating syringe service programs in the state of Maine, which thank God for their work, but also, and this money is for certified syringe exchanges in Maine. And I think, Mary, you just raised my other question was around the other 125,000 that we set aside for new certified syringe exchanges. Have we talked about, or do we need to talk about, and where should we talk about how that, like, is it just the next one that comes into the pipeline? Did we give it to the CDC to allocate? Do we know how we're going to do that? And then to answer Brendan's question, should it be allocated to each site, or should it be to the organization to distribute as necessary? That's a good question.
I can clarify that if that would help.
Yeah, that would help.
Under the statute that establishes the the SSPs, or the certification for the SSPs, it calls for the the CDC to allocate the funds that the legislature made available based on various factors, which include rates of intravenous drug use and negative health outcomes related to drug use in the geographic area surrounding a program, if applicable, the amount of services historically provided by the certified program, and other relevant factors. So it's my understanding that the CDC has a formula that it uses to, or has used to allocate the funding provided for the program established by statute. I'm not suggesting that the council use that formula or that it ask a provider to use that formula. My understanding is the council just said $75,000 per site. And so it could add complexity, but it could add nuance if the council decided it wanted to use a formula at this point. There's pros and cons about that.
I think we should stick with what we said, the $75,000 per site, regardless of the state's formula, for two reasons. One, no offense to the CDC, but I think that formula is flawed. And two, I think that certified syringe exchanges are already starting to budget. Like, we've flagged to them that this is coming per site. And I think backpedaling at this point would be disingenuous.
That sounds right to me.
Yeah, I don't disagree. I agree with that as well. Well, at least your second point. I won't weigh in on the flawed nature of the formula. But I think we would all, if we contemplated something else, I think we would want to set a minimum threshold per site, because we want funding to go statewide and to support all of the sites. So that it's going to get more complicated. So I do think it makes sense to just stick to what we original intention was, and we could consider something in the future if we needed to.
And then regarding Courtney's second point about the remaining 125,000 for a startup, I'm not aware of any discussions about that the council has had about how to identify or receive proposals for a startup. Mary, you should feel free to weigh in if you've heard or given some thought to that. But at this point, I'm just focusing on the getting the money out to the 18 established ones, and then happy to have follow-up discussions about the remaining 125.
I will weigh in that I've spoken to Carolina at the the CDC, and I've asked that she keep me posted about any new sites that are seeking certification. Not that we would necessarily fund those, but so that I was able to provide the council with the most up-to-date information about the goings-on at the CDC. I did say that we would establish a process for how we would go about allotting those funds. But once again, to just keep you all informed if there were opportunities, if they were ones we wanted to move forward with, then we would have that information.
I hesitate bringing this up because it's going to get us off track a little bit, but I do think there's probably, like, we're reviewing the LOIs right now, right? And there's going to be intersection between what we, like, for example, this 125,000, there might be a syringe service provider out there that we could allocate that funding for that came through the LOI. So there's going to be, which I think would be good, and like sort of a synergy there, that we don't need to go develop a new process to get that funding out. We could just fund it through that December funding round as opposed to the LOI. Well, it would be both essentially, but I think there's going to be other things like that, right? Like, we're going to want to try to triangulate between what we funded in December versus the LOI too. So Mary, we don't need to discuss that now. But it might be, I think it's a topic for conversation at some point.
And I do think it's important, you know, and on the agenda, we have discussions around some of the letter of intent scoring of considerations. And I do think if the finance committee would like to make the recommendation, you know, that we utilize some of our December allotment in this grant application process, if it's applicable, then today's discussion would be an appropriate time for us to do so.
Great. Yeah, actually, that makes sense. I wasn't thinking about that agenda item per se in that context, but that does make sense. So let's just put a pin in that for right now. Brendan, anything else on syringe service contracts or any other contract issues you want to discuss?
Two other things that just a brief diversion to the prevention contracts with Mayan and the Alphon Foundation. Part of what Mary and Katrina are going to be helping me with, and I think probably I'll be leaning more on Katrina for this, is pulling together information to better understand what it is that the council is going to be funding with those entities. And I know Mary's had a lot of conversations with those entities. So that, just to put more clarity on what it is we're doing. In general, with contracting, you know, this group, or maybe it was the program or grants committee, this group, that committee found it helpful, I think, to engage in a conversation about budgeting with the folks in Piscataquis County around what they were going to be doing with the money. So I have a couple of questions about contracting generally in terms of these December funds. You know, one is with some of these, you know, other contracts, I think maybe beyond the SSP ones. Does this group, you know, want to receive information about what, you know, those identified grantees, you know, plan to do in terms of budgeting? That's the first one. The second one is, you know, does this group have any feedback for me or guidance about what to do about the discussions around a cap on admin and, you know, overhead? You know, this committee, I think, has voted perhaps on a recommendation of a 10% cap. I don't know that that's been voted on at the full council level. And Mary raised the question of whether, even if that had been voted on, does that apply to these December contracts? And if not, you know, I think I probably do need some guidance about whether and what to write into the contract for a cap on admin and overhead. I'm happy to postpone those to, you know, because they may be big topics, you know, and I don't want to derail your agenda, Ben.
You know, I mean,
those are
just the second one quickly, because I continue to be of the view that I think simplicity and consistency with working within the statute is important, and I like just a flat 10% or up to 10% for that. And I think that it would be applicable to all contracts that the Maine Recovery Council puts in place, irrespective of what funding round they are part of. I saw Courtney's hand go up next.
I agree with Ben on the 10% across the board, up to 10% across the board for overhead / administrative. What was the second part of your question? Oh,
Budgeting
seeing the
conversations.
budgets. And I'm open to feedback on this. I don't know, maybe I'm wrong on this, but I would think that they should submit a budget to mayor different organizations. So we should see 9 budgets and it should be put into one document. So just so that we have our eyes on it, but I don't think I need a presentation from 9 different organizations about what they're going to do, like we had from the recovery center at the grants committee. So yeah, that's where I'm at.
Matt?
So why do I think we voted on an administrative cap somewhere? Or am I crazy? Or imagined it? But at some point,
a lot of conversations, Pat, but I don't think we ever got anyone to like put forward a motion.
yeah, I thought we did, but I know we've discussed it. I know we've discussed it at both the grants, finance, and with the full council. So if we need to put a vote to it, let's figure out a way to do that. Second thing I just want to say is I think they should submit somewhat of a budget, but remember when we gave this money away, it was flex dollars. That we really wanted these organizations to be able to use this money for purposes that don't really qualify in other places. So I just don't want to tie their hands too much. Again, a budget's nice to ensure that it's not going to all admin costs, that it's going to either direct service or whatever. But the whole idea of this was flex dollars. So I think a budget would be nice. I think that budget can be submitted to Mary and in regards to contracting, saying whatever. But I would like to see the budget simplistic and not too detailed, or you're going to take away what the intent of this money was, at least from my interpretation, which was it was to be flexible.
I don't disagree with any of that. I wonder if we should include, I wonder if the prevention, the ad hoc, I don't know if ad hoc is like a formally part of their name at this point, but the prevention committee could take a look at that, the budgets or the scope of services or something, since they do, like Liz and whomever else is on that probably have a little bit more insight than I would have per se, but.
Look at what, Ben, their budgets?
Yeah, their budgets, I think we need to put together, but I mean, the budget's sort of in a secondary thing of like a set of deliverables of what they're doing, but maybe that runs a little contradictory to Pat just said. I think we want it to be flexible, but also there needs to be some sort of outcomes-based statements in the contract of what we're getting for the funding, and we're going to need to report on that anyway. So that scope of services and then the associated budget will need some sort of, I presume it would go into some sort of detail on the prevention side of things, obviously.
I'm backpedaling on my budget thing because I agree with Pat, and Pat's actually right on this. So, I think it should be very, very easy. And like scope of services, they must have like contract requirements for their CDC funding. Can we mirror those, and also the same mirror for their reporting, so they don't even have to do any new reporting? They just tell us what they're telling the CDC about what's happening at their certain service program. Is that possible?
Yeah, for just sticking with the SSPs, that's what I'm doing for their contracts. Just using what I understand to be the scope of services or the deliverables that they follow under CDC contracts, and the same with performance and financial reporting. Just using whatever, asking them to do the same thing for us that they do for the CDC. For the prevention contracts, it's my understanding that Mayan has a contract with the state to do this work. So we'll be looking at that, and my expectation is that my goal is to mirror that for the Alphon Foundation, which does not as I understand it, have an existing contract with the state.
Oh, Ben, I was confused. I thought you meant you wanted the prevention group to look at the strange service budgets. And I was like, wait, that
No.
doesn't make a lot.
Yeah, no.
Okay, I'm on the train now. Thanks.
Can I also chime in and add that we did have the prevention groups present a proposal to program and grants. And in those proposals, they included an outline of both their scope of work and their planned use of the funds. It was fairly broad, but if that's information that would be helpful, I can share that with the prevention group sooner rather than later, to hopefully help move us forward with the contracts, if that would be the will of this group. I can do that. We may be speaking about more detailed budgets than what was presented, and if that's the case, then I can reach out to the organizations directly.
Yeah, let's maybe follow up offline and we can figure out exactly how to. I think we can move these forward and it'll sort of become clear of what we're doing here. We can bring it back to the council or this subcommittee for more direction. Anything else on contracts?
Just the last thing I'll say is general grants that I've gotten from like MEHAF, I just had to put like a very simple budget together. And also they were like, and if this changes, that's okay, as long as you're continuing to do this work that you said you would do.
Sounds good. Okay, a couple items, switching gears to the letters of interest and the grant application overall. A couple different topics we wanted to hit on. I'll just run through them quickly so you can organize your thoughts. We'll start with the period of funding for these contracts. We asked for, I'm sure you all remember, 1 year or 2 years of funding. I just wanted to, given the significant interest we've received, we could tend toward more 1 year contracts, which will allow us to put more contracts in place. But we can talk about that in a second. We also need to identify sort of what the purpose and what type of gateway the letters of interest is going to serve. Are we trying to move everything that is eligible forward, or do we want to prioritize slightly and invite only the highest scoring or otherwise most critical applications forward? Because just as a reminder, we had $87 million in requests. We have $12 million to dole out. So I do not think it makes sense to move everything forward that is eligible, because we'll just be scoring 4 out of 5 contracts won't be getting anything, because and I do think some of the weeding should take place at this point. So I think Mary has thrown out, and I tend to agree, something around like 2 to 3 times the amount of money we have for each pillar, and we can talk a little bit about that in more detail in a second. And then some, like Mary mentioned before, some questions or just some context around how to score the LOIs. I think it would be beneficial for us to review that at this point too. So just going back to the top, the period of funding, we originally recall that, we put together the first year budget of $15 million. 10 of that was ongoing funding, and 5 of it was one time. So, 1 out of every 3 projects that we fund, in theory, would only expect to get funding once up front at this point. Just based on my review of the LOIs to date, not calling out any specifics or anything, but most of it is 2-year funding, and it seems like ongoing funding. So that is going to be a pretty big consideration, because we will run out of funding quickly if we try to fund a bunch of contracts year over year over year, because the funding is so front forward. I was thinking, though, it might make sense to fund more contracts on a year basis instead of 2 years up front, and then see how those contracts perform before extending them for a second year. I think this is certainly a full council conversation, I think, and depends on how all the LOIs get scored, but I think it might make sense to try to fund the best applicants for 2 years, but a good chunk of them only for 1 year, which would let us fund more of different projects and also let us evaluate them more before locking in the second year. Providers and organizations are obviously going to want 2 years up front, but for each pillar we approved $12 million. If we do everything for 2 years, we're funding $6 million a year, which is going to potentially not go very far to many providers if we do that. It's sort of it's a fairly nuanced issue that I'm bringing up, but are there clarifying questions or other questions about this or opinions? Pat?
So I'm going to put on my old executive director hat. A 1-year grant is a really pain in the butt. So I don't have, so here, if somebody's requesting to buy a building, or if there's something in there that's, upfront and done, but to really only give an organization, particularly a startup, 1 year of funding really is difficult to expect any impact at all in a 1 year time. And if we're giving money to reflect impact and change, I'm not sure 1 year gives them that opportunity to do that. And so I wonder, what we would get back in info or in data by only doing 1 year at a time. The other piece is a selfish piece that if giving 2 years out gives this committee some breathing room to continue to design a process for the next 16 years out. Because if we're doing grants every single year, we may burn out council members unless we develop a system that includes members of the public, the general public, to help us score these proposals. So that's sort of what's in my head in regards to 1 year for me just seems too short a time. But then again, I don't know if we have people just requesting funds that say, I want to buy a piece of property and build a house. So those are my thoughts on that. Thank you.
Yep, those all make sense, Pat. Thank you. Representative?
I would agree with what Pat said. I feel a little bit torn. If there's a 1 year need, fantastic. 2 years seems reasonable, but my other concern is then also like funding programs that are going to need ongoing funding. And so there's that false hope of we'll give you 2 years, and making sure we're spreading our funds around the state for different programs. So it seems like a really fine line to walk, but I certainly would lean towards 2 years.
I don't disagree with either of you. I will just say it is going to be very challenging to prioritize. I've reviewed most of my LOIs, and the money is not going to go far for what we have budgeted, and we are going to be saying no to very worthy projects unless we're going to divide by 10 everyone's budget request, and which I don't think we're going to do, because that is the worst possible scenario, I think. But it's gonna be challenging, and we can figure this out. But I at least wanted to raise the concept so that we have some options if we want to go that way. And just also, in my view, we don't even have enough one-time requests out there to fulfill the bucket that we've already sort of drawn for ourselves. We're going to have to fund 2 year funds with 1 year funds and say you don't necessarily expect this for a second year, because we don't know if we'll have the funds. The funding does. I don't have the budget in front of me, but we ramp down in year 3, so we're not even everything that is funded for 2 years won't get a third year, unless we're parsing things out differently in the future. And again, takes time to do contracts and everything. So it's the fund, our budgets we're gonna have to just sort of evolve as we go along here, because we're gonna have different amounts of money in the bank and under contract than we thought we did. But other thoughts, I had a couple other thoughts too. From my review, I looked at 50 LOIs or so. I haven't seen many startups, honestly. Maybe it's just the ones that I've been assigned to. So that is a consideration. Yeah, I think some of the projects are interesting proposals, I think would be, and we could, something that, and less evidence-based potentially, or maybe a little bit of a bigger reach that we might want to, and then we always have our discretion to just say, let's do this as a pilot for 1 year and see how it goes, or something. That we're not precluded from doing that. Courtney?
Sorry, Ben, I appreciate your foresight on this. I wonder if maybe it's also like a process problem, right? Like I want to know all the answers right now because that's type A personality that I am. But I feel like some of this is going to have to be worked out in process to some extent. And I'm super also very torn. At first I was like, oh, that's the smartest idea ever. And then I was like, oh, wait, there's flaws to it. And so I don't know that we're going to have an answer to this question until we at least get through the scoring of the LOIs and can see how that's like formulating around. Is there clear top runners? Is there clear low runners? But that being said, around the question of should we be narrowing through the LOI process, I think that we absolutely should be narrowing through the LOI process. I think the LOI, the intention, my understanding of the LOI, why we even did it, was to ensure that we're not giving false hope to organizations that we won't fund in the end, and allowing them to move on quickly, and to not use precious staff / volunteer time to write a big grant proposal when we don't even have money to. And I'm not good at math off the top of my head, but it's a lot of money that we don't have. So I think we should definitely narrow in this process.
Good, and thank you let me just put a pin in that first topic. I completely agree. I wasn't suggesting, sorry if I didn't frame it appropriately up front. I wasn't suggesting we should make a decision on 1 year versus 2 year funding. I just want to plant the seed so we can be thinking about that. It's something that I was thinking about as I was going through here, so that we're like not sitting in the council meeting, needing to make decisions and not having options before us. So I think we've had that conversation. Let's move on. I'm happy to talk to anyone offline if you have questions about it or whatever, just conceptually. But Courtney has brought us on to the second item, which is how many LOIs should we put forward? And it's probably that sort of that decision point, I think, is rightfully made by dollar amount, not the number of applications. It's the dollar amount that is meaningful here. Recall we did $12 million, $4 million per the 3 pillars. So that is what we have for each of those pillars for this funding round. And but Mary, did you want to tee this up a little bit more in terms of what you've been thinking?
Yeah, thank you, Ben. So as I've been reviewing the LOIs, and as you all have been as well, we have about $75 million worth of proposals that we will not be able to fund. And I know when the council began this process, we established the $12 million as the total amount we had to allocate towards grant funding. And our suggestion was to allocate $4 million per pillar. My recommendation to the council is that we not exceed 3 times the amount we have to allocate in the proposals that we invite to submit a grant. So in other words, I don't believe we should go over $12 million in each pillar in terms of who we're inviting to move forward and submit the grant proposal. And that's, as Ben mentioned, in fairness to the applicant and wanting to be realistic. And the letter of intent was our first part of this process and was more an information gathering step than really a process for us to sort through which ones will and will not be funded. So when we get to the grant application, I want to set us up for success so that we don't have to have a process where we have to eliminate $75 million worth of applications and also ask all of those folks to submit a grant when we know it's not feasible. And I think if there is, the opportunity for this committee to make a recommendation to the full council as to how many proposals per pillar we should invite to move forward, that would be helpful. And that total amount being in terms of dollars requested versus the number of applications. I do know that there is quite a bit of variety between how much was requested per pillar. And so that's something for us to keep, into consideration. For pretty obvious reasons, a lot of our treatment proposals requested more money because treatment, there's a much more infrastructure cost, and they're also reaching often more folks. So something for this committee to just begin discussing so that we have a path forward when the full council meets. Does that make sense?
Thank you.
Mary, there's some discussion in the chat around what we actually have. Could you clarify how much we all said we have in totality? Is it 12 million for all 4 pillars or 16 million for all 4 pillars?
Yep, we have 16 million for all 4 pillars. We have 12 million for this grant application. So for 3 pillars, and that is operating under the assumption that each pillar will receive $4 million worth of grant funding. My recommendation is not to exceed 2 to 3 times what we have to actually allocate in what we invite to move forward. So my recommendation is that we do not invite more than $12 million worth of proposals to submit a grant in each pillar. And that would be 3 times what we have to allocate. So $36 million total, I would recommend as our cap for how much we move forward for inviting for a grant.
Got it. I love your proposal, and I think we should do what Mary says.
Thank you.
I have one twist on it because I like to complicate things, but I'll let Sheriff Brackett go first.
First off, can you hear me?
Sure can.
My IT folks are great. It took longer than I thought. I apologize. Coming in late, this may have already been discussed, but I don't remember. I remember the discussion around limiting funding per pillar, but I don't remember that was ever finalized. Was there an actual vote on that? I mean, I don't remember, but I mean, are we physically restricted to $4 million per pillar? It has to be broken up that way. That seems to be the way the discussion is going, because that's the only question I had about your concept, Mary.
Yeah, and that's a great point, Sheriff Brackett. We voted on the 12 million allocation, but we did with the recommendation, I believe, to have 4 million per pillar. So, and that also is taken into consideration with this 3 times recommendation, that's operating under the assumption that we want 4 million per pillar. But we can also move it, to more broadly saying we won't invite more than 36 million, which is the 12 times 3. So I think we can look at it either way. I do think a funding cap recommendation is important, especially when we begin the scoring and we have all of those in front of us.
Courtney, did you have something else?
No, sorry, I'm on my phone.
My only thought, and I haven't, Mary, the only different flavor to this would be instead of just going with the budgeted amount so we would have up to $12 million per the 3 pillars, which is going to get confusing because the 12 million is the total budget for all of the pillars too, but numbers repeat themselves all the time. Was maybe we take the I guess never mind, my idea is not going to work, but I was thinking we try to scale it based on the amount that was applied for each pillar, because I think it's safe to say that treatment is going to constitute a lot bigger percentage of the total of the 75 or whatever million total that was submitted than harm reduction. So should we try to while we would we would just increase the number of options we would be inviting for the treatment pillar. For example, we would still be aiming to get 4 million out per pillar, but it would be scaled slightly and driven by the applications that came in instead of the arbitrary budgets that we made. Miles?
I'm sorry if I missed this, but is there some sort of rough estimate on how many applications or how much money per pillar, what that looks like? How much folks went for treatment or have asked for prevention, for harm reduction? What does that look like?
Yeah, I can provide some context, and these aren't final numbers, but this will give you kind of a ballpark estimate. In terms of the total amount of funding that was requested, let's see, I might only have right in front of me. The average funding request for treatment, it was 540,000. For harm reduction, 475,000, and then for recovery support, 280,000. And I'm sure we could do the math, but the total funding requests per pillar, so the total amount of LOIs we received for treatment, there was 73, harm reduction 36, and recovery support about 112. And a couple of those numbers need to be tweaked, but harm reduction, we significantly, received fewer of those. Recovery support, again, 112, and then our treatment was about 73. And I can see if I can also let you know that the total funding amount requested in year 1 was about 50 million. And the total funding amount requested in year 2 was about 37 million. And I will have final numbers for the full council to review. But I hope that provides a bit of a snapshot.
So Mary, you're saying that, right? It's the funding for year 2 doubles?
No, it's the other way around. So let's see, we have year 1 it's about half of what year 2 funding request is, about half of what it is in year 1. So year 1 is
year 1 is the
million.
more expensive, and
Yes.
then in year 2 it's okay. Thank you.
About 38 million. So it's not half. Still quite a bit, but we have, yeah. And again, that gets us to about 87 million in total.
This might throw a little bit of a wrench in it, and it might not be a conversation for today. It might be a conversation for later, but as we're thinking about LOI narrowing, I think we should also provide some more guidelines to grantees and writers of grants about funding limits. One of the things that I struggle with, like, I think I was one of the ones that advocated for this, but as I went through the process, and I've heard from other people that went through this process, that it would have been easier to write if I knew that you were gonna fund, these are random numbers in case anyone's listening from the public, but you were gonna fund 10 applications at $50,000, 20 applications at 100,000, and 30 at $500,000 or something like that, to just like provide some context around, and for me and other organizations to make decisions about what we think is most strategic and what we can propose to within those budget buckets. So I don't know if there's a way for us to say, as we probably in the application process now, but for us to say, under treatment, we have 10 grants available at $50,000, 10 grants available at $250,000, et cetera, et cetera.
Yeah, I mean, just a quick, just absorbing that a little bit. I do think that might make sense actually to do for the grant application. I think I like the way that we did it, completely unrestricted in the first place, because we just wanted to see what the need was and what organization capacity is, and it wasn't influenced by they need to try to fit in this certain round peg square hole type situation. It probably wouldn't have been that big an influencer because we naturally got small grant requests and large grant requests, but I think I do think that would be interesting to consider for maybe the grant application. So folks could maybe tailor their request a little bit more. I guess my only point, or like the discussion point here, I think you said the average grant is 540,000 for treatment, and there were 73 of them, so that's $40 million. That's exactly wrong. It's somewhere in that ballpark though for treatment. So if we only take 12 million, we're going to be excluding a lot more treatment and recovery applications than we are for harm reduction, just because we'll be particularly excluding a lot of treatment, because I think you said recovery was the smallest average dollar amount, but they had the most applications, and harm reduction was in the middle, but they had by far the fewest. So it doesn't, I'm good with the 3x multiplier of it, and maybe we try to scale it somehow based on the volume of requests that we got in. So it's not 12 million exactly per pillar. We allow a few more on the treatment and recovery side. Again, this isn't, we're just letting more through apply. It doesn't matter. It's really, I don't know if we need to treat every pillar the same, but I'm open to ideas on that. Todd?
Yeah, so I don't have a clue what I'm doing. I've never done this before. So this is probably a stupid idea, but I'm just thinking of a hybrid process, of kind of what Mary's, I think we all agree that we want to we should put some funding in each of the pillars. Whether it's exactly 4 million in each pillar or not, okay. But so if we were going to say something like, we're going to make sure that at least $1 million goes into each pillar, and then we were just going to rate the LOIs or the grants as they come in. The LOIs is what, you know what I mean? And the top whatever number that fits into that dollar amount that Mary has suggested. And then you do 3 times that, you know what I mean, or whatever, to try to, and that would eliminate, I think, Ben, the situation that the majority of those would be eliminated would be in the category that you were just talking about, right? It would really depend on just the applications and just how they're scored, and we're making sure that some money goes out. I mean, probably that's too complicated. I don't know. Like I said, I've never done this before. So I'm just trying to think of ways that you kind of make it equitable. Because I like the concept that Mary has. Anyway, that's what's on my mind, for what it's worth. Sorry to waste your time.
Oh, good. I think it's safe to say no one's ever done this before. So we're sort of all sit in the same boat. And I just, as a reminder, I think we have preliminarily said that we were going to push out funding in an equitable manner, and that number is 4 million per pillar. So we can adjust that based on once we see more, some of those numbers that Mary just said in the aggregate. But I think that's what our intentions were to do, 4 million per pillar eventually for everything. Pat, did you have a question or comment? You're on mute.
I'm on mute. I do like Todd's suggestion, and again, it gets a little complicated, but there are probably ways to do it. I do think though that we have to be open-minded. I think we can't be closed-minded just to say 4 million and that's, or 3 million and that's it. I think the intent is to be equal throughout the pillars, but I think as a council or as a group, if we see projects that are, this huge need for, we have to be able to be flexible. And I don't think we ever voted on the 4 million. We just said we would do this equally amongst a house somehow. And it may turn out that it does end up on one or the other. I will tell you, I've reviewed grants before, and the hardest part of reviewing these LOIs for me is the dollar amount, and I have no idea where they're spending it on. So I look at the dollar amount and I think, well, what are you spending it on? So lessons learned, a small budget would have been nice for me because I had no idea. Like I know there's a program that's funded through this agency and I know they get funding from someplace else. So why do you need this money when I know you're getting money from there? What is the extra piece you're doing? But we didn't ask that in the LOI. So that for me is probably the hardest thing. All we know is the end product of that lump sum for the budget. And but I do think that, I don't know if we can do it this time, but I think Todd's suggestion is looking at things and weighing them out makes sense to me.
So I don't think we made a decision here, but Mary, do you have enough to run with? Do you have questions on how we want to possibly constrain who we're inviting for the final grant application process?
I think I've captured most of it. So Todd, just to make sure I'm hearing you correctly, your recommendation is that we weigh the applications by pillar based on the number of applications we received. Is that correct? Or did I misinterpret that?
So I'm agreeing with you, Mary, and your product. I just hope that we're not so stringent in that if we look at it and it really isn't making any impact, that we as a committee are able to explore more. I think your proposal makes sense as we move forward, but I'd hate to be closed-minded. We have an arbitrary number, which is, so much per pillar, equaling it out. And then once we see the whole thing lay out, and I do agree with your, what was it, 3 or 4, was it 3 times? The allocation? Yeah. I agree with that there's some projects that we're just going to not be able to fund and figure it out from there. But again, just to be a little bit open-minded when we do it, not be totally closed.
Great. And what I can do, and this is helpful because when we do all meet as a full council, I can have some of that information about how to look at it differently if we do weigh it. And I also plan to do that with the scoring based on the number of submissions a reviewer scored, that could also factor into what we're seeing. So that's very helpful. And I'll make sure we have that information for the full council. And Ben will likely be having you check my numbers.
Happy to. I hope you took some Excel training before you took this job. Courtney, did you have something?
I had something and then I forgot what I had. So
sorry to blow up your phone. Let us know if it comes back. Okay, so maybe we'll Mary, it sounds like you'll have like sort of what it would look like if we just went with like 3x per budget for each of the pillars, and then we can also maybe weight the pillars differently based on the volume of applications or the volume of funding, so that we can maybe scale up the number of LOIs that we're being invited to apply for the grant for probably treatment and maybe recovery, just based on the fact that there's just a lot more applications for those two than harm reduction. And then I guess what I also heard was, and we possibly should revisit whether or not we're just doing a peanut butter spread across all pillars based on the LOIs. I think that's a hard conversation, but I think one that we are responsible for to make sure that it makes sense to do 4-4-4-4.
And I will add to that, I do think that when we see the final scores, that will provide really helpful context for us in that discussion.
Yeah, and maybe you're going to get to this, and we're running out of time because I'm doing a bad job time managing our committee meeting again. But I do think we're going to get, I just wanted to plant this seed as well for consideration. I presume, without giving away any of the applications we had, I presume we're going to get applications for similar services across the state, right? Recovery centers, for example. We might not want to award on a case-by-case, recovery center by recovery center basis. We might want to, for lack of a better description, we might want to take an approach like we did with syringe service providers and just say we're gonna do X amount per center or per this type of organization. And we know you all applied, whether it's low barrier shelters or recovery centers or whatever else there's multiple of across the state, and take a sort of a more formulaic approach that we could support them, but not base it off, because some might apply for 4X other ones, but we want a little bit more consistency there.
That's it, Ben. That was my thing. It's built on that. So yes to that. I think we probably should have just done that when we did SSPs and we wouldn't be in this situation, but here we are. There was a lot of context happening. The other thing I was wondering, and we don't need an answer to this today, but I think it's something the full council should consider, is that if there happens to be anyone inside of the LOIs that are doing a service that we already allocated money for, such as a detox in Androscoggin County, would it be feasible, instead of sending an RFP out, that we just say, okay, that's the one. We already had that money allocated and we should fund that. And there might be other projects like that, such as a certain service program or something that we already allocated money for, and we can get them out of the loop earlier because we already have the money for them.
There are instances like that, and I think we should consider it. So it's a good point to raise. Other thoughts? Okay, Courtney, did you have something else, or? We have 15 minutes left. I have a 2:30 as well. I'm sure you all have meetings as well, but I think what the two final agenda items we'll hit today is, Mary, if you had anything else on how to score LOIs, and then vendor support, and we will call it good there unless I hear from anyone else right now. Okay, Mary, you're up with those last two items.
Thank you. So to finish up the LOI scoring discussion, I do think it would be helpful if the committee can at least start the discussion around any constraints we want to put in the total budget and what folks are requesting funding for. As we all know, we have to make sure that our funding is allocated towards the approved uses in the MOU. But similar to our discussion around the administrative costs and those rates, does this committee have any thoughts or recommendations for how we move forward with other budget costs, such as capital costs, whatever it may be? If there are recommendations, that would be helpful for us to present to the full council. Again, we'll see how the scoring plays out, but that could be another potentially helpful recommendation for us to use moving forward. So really, are there any other constraints or limitations? I don't know if either of those are the right word, but that we want to put on the budget and what folks can request funding for, or how much they can request funding for under those different categories.
The thing that I keep coming back to a little bit, and we've discussed this a little bit, is applications for individuals, and whether or not we are considering those eligible providers when they're not incorporated at least as an LLC or a 501c3 or for-profit entity. It seems like there's some pretty small organizations that are not incorporated at all that we may or may not want to support, and there's valid reasons on both sides, I think, but that's one consideration I have.
Yeah. And I would agree with Ben on that. I saw a couple applications that I thought, well, they're the individuals where, who are they, and somehow finding a way. I'd hate to discourage an individual, but there has to be some way, and I hate the word, but I guess vetting them or ensuring that funding is accountable and that it's going to the purpose that it was stated. But for the most part, I think, Mary, there's lots of conversations that will probably happen after we finish scoring about what we'll do differently. And again, one of that is if we had a small budget, some of those questions could have been answered. So thank you.
Miles?
So I just got a question, and I don't know if it's been brought up, but how about folks who don't need the money? So like places that have like already make some serious coin, and and they're applying, because it's out there, which is great, and I know they do great work, but at the same time, they're already making some legit money. So how do we find that out? Like, or how do we vet that? Because I want to make sure everyone is eligible, but at the same time, this money is not, if they're already making so much of a profit per year and don't need this money, then I don't see why we should give it to them. So whether it's a for-profit or non-profit, or it doesn't matter, but I guess that's my question, is how we're gonna do that and vet that.
Did you have a follow-up to that? You're on mute.
Sorry, I just had a quick follow-up to the individual question, and I saw Courtney's comment. I don't necessarily disagree. I just wonder if it matters if it's an individual seeking funds for themselves, or if it's an individual who's seeking funds to provide a service.
That doesn't matter from my perspective, but especially someone who's seeking funds for themselves, like I don't, at least if we want to consider that, I think we should set up a specific program to do that, not do that through this funding round. An individual that's proposing to deliver services for other people is something else, but that just suggests a maturity of the organization that is pretty at the beginning, I think. And it actually sort of goes to Miles' point. I wrestled with that too on looking at the LOIs. I think obviously the best example of why we would fund larger organizations is the scale and reach and impact that they can have, and they're going to be able to influence, and they have the network infrastructure and capacity already to deliver services that other small organizations may not, that almost certainly would not be able to. So I've been thinking that I haven't been excluding anything like that, but I actually think we want to mix, certainly. But it is a hard thing to wrestle with, because we're getting the full gamut of organizations applying.
And maybe that's something for the grant application, that's a question to be brought up when the grant application comes. How much money do you make? Let's see your taxes. Let's see some, I don't know how possible that is, but just a thought anyway. Sorry, I cut folks who had their hands up, cut off Facebook.
Well, good, Brendan.
Just briefly on the, on those 2 points, Miles' point and Sharp Brackett's point, on the individuals, the thing that I keep going back to is looking at whether whether the proposal is going to be spending the Recovery Council's funds to help abate the opioid crisis. Are there services that are going to be provided to people in the state of Maine to help them either avoid or recover from, opioid use disorder? And so, whether an individual is applying for money for their own purposes, that's how I would filter it through. Is it evidence-based? Is it abatement? Is it helping the state of Maine, recover from the opioid crisis? I need to see the specifics about it, but that's sort of what I think about in terms of individuals. And in terms of, I have forgotten Sheriff Brackett's comment. So I guess I'll defer. I see time's running out. Courtney had her hand up. I don't want to dwell on that.
Super quick. I agree that So individuals who are providing services, I don't think should be eligible at this time. They at least need to go get an LLC incorporated. It's like $50 at the state house, not that big of a deal. For individuals who are asking for money for themselves, I think that either two options on that. One, that's a different grant application from the Maine Recovery Council. Or two, I'm actually quite a small government person, so I think that that's actually a service that should be provided by a different organization, not so much by the Maine Recovery Council. Like, we gave flex funding to the CAP agencies, like, and then the CAP agencies are going to push it out to community members. Like, if we want more money on the ground for individuals, we should give more money to the CAP agencies. And then on the organizations that make boatloads of money, I don't think they should get this, particularly organizations that are for-profit organizations that make boatloads of money. They could just go like take out a loan if they need a van or something. I don't know. I'd be more compassionate about nonprofits that have large operating budgets, because I think that's different than a business that owns everything that they have getting this money and making boatloads of money, which is different than also a small LLC that isn't making boatloads of money, etc.
Don't disagree. I have a thought on that, but Sheriff Brackett?
I just wanted to say, I think Brendan answered my question. I think I just don't like to see us eliminate things this early on completely. As long as there's we can have an open conversation later on about an individual. I could think of a couple of scenarios, especially in an island setting where, and where there's just not a lot of people, but the issue is there. And I'm not opposed to the criteria that Courtney just said, okay, go get an LLC and we'll consider you or something if that's what you need to do. But as long as we're keeping the open mind about it and I would say the same thing about the big companies, you know what I mean? I don't disagree with the concept, but let's take a look at what they're proposing and how does it fit with something else and that's going on there before we make that final decision.
Thank you, Sheriff.
My comment was just quick that I think it's important to be open-minded, that I think that for-profits, I certainly are always been my heart and soul, but there's a lot of for-profit organizations that do good work. And for one reason or another, they are considered a for-profit. So I think I caution us in making those judgments unless we look at the organization. And sometimes in my work, as much as, again, I spent my whole career in small nonprofits, the large companies are often ones that can provide services that most of us can't afford, being small nonprofits. So again, I think we have to be open-minded. We certainly want to fund programs that struggle with getting funding, maybe sometimes traditional ways, but I think we have to be open-minded into where those sources come from.
I'll just quickly add, the opposite is sometimes true here in Maine, that there are some nonprofits that look an awful lot like for-profits. But Brendan?
Just on the large profit discussion, just the point that the council has the ability to both, as it looks at the need in the state and in a given community, if it can make multiple choices. It can see that there's a need that's not being met and, allocate funding to that. Even if it's somebody's making a lot of money, if there's a genuine need and the only person or the best entity to do it that is very effective, it can make that choice. Conversely, it can look at it can identify a need, see that it's a very important need. Somebody's already spending money on it, but the council can choose to add money to that, can supplement it to for the purpose of jet fueling that that work. And it could be that the provider of that is somebody who's already making a lot of money, but if they're very effective and they're already doing it, those are conceptual arguments.
Brittany?
Super quick logistical question that doesn't actually kind of relates to this, but doesn't. So maybe it's a Brendan, Haley, or Mary question. At the very end of all of this in September, when we've made our decisions and we're finalizing, are we going to have a roll call on each individual grant? So like if I dissent from Joe Schmo, getting a grant, am I going to be able to put that on the record?
I think I would probably look to Pat, you know, and some of the, you know, and the council as a whole to consider how you want to handle that.
Okay.
So again, that discussion has not been there. I think that if the grants committee looks at it and has a recommendation, I think it's open for discussion as to how that role will call. We've never done it before, so it's certainly up for discussion. For the most part, serving on nonprofit boards that have grants, it's usually done as a bulk. That the subcommittee had a recommendation, bring it to the full board or council, and it's voted on. It's not usually done individually, but we certainly can do that if that's what the council wants, and we will bring that discussion to the council at some point.
Okay, thanks.
I was, according to my mind, was right there. This is what I wanted to say before. We need to set up a process that enables the council to have discretion at the end. So I think we should just, the website, our council work, we should keep saying that we have the ultimate say and we want to do this by consensus and everything, because looking at the LOIs, the well-funded organizations are going to have better write-ups than smaller, less organized. You know, some have government affairs teams, and then some people submitted applications with a grant writer, and then some of the executive directors themselves submitted, and then some are like all volunteer based. So like there's going to be a natural bias towards some of the large organizations because they're going to have a much better, well-conceived plan to how to do this and just the write-up and description of everything. So I think we're going to need to have a discussion at the end of this, which is sort of what that recommendation column is, I think. And we're going to need a group recommendation, not just the individual scores recommendation, that we are going to say, look, we have too many, you know, Fortune 1000 companies in here. We want to prioritize smaller ones, even though the LOI scoring suggested that all the big organizations should do it because that's how it's going to fall out, right? So, Courtney?
I'm all set, sorry.
Okay. But we will certainly need to have those conversations. I think we have a good process in place so far. We have left zero time for vendor support, but Mary, anything very quickly on the vendor support topic?
No, I think that'll be a good discussion for our next meeting at the end of August. Thank you all for this discussion. It gave me a lot to move forward with, so I appreciate that.
Anything else quickly from anyone?
Mary, did you still want to contact? Are you good? Did you get my email? I think I've got it licked.
You figured it out?
Well, my IT folks helped me figure it out, yes.
Okay, I'll respond to your email for this.
Okay, if I need you, I'll call.
Okay, perfect.
Thank you.
Yeah.
Very good, everyone. This meeting is adjourned. Thank you for a good, robust conversation.
Thank you, everyone. Thank you, Ben. Oh, wait.
Real quick. Sorry, Mary, I attempted to take notes, just a heads up. I don't know if anybody else was, so I'll send them to you sometime soon.
Thank you, Miles.
Yes, thank you.
Thanks, Miles. Thanks, everyone. Have a good day.
Carry on.